Good morning. This morning I'm going to be discussing the third part of my series on my weight loss journey. I'm going to start with being discharged from the hospital and being sent home. I had previously been given my prescriptions to get my pain medication, and I must say pain was a minimal. I was given, I can't think of the name of the shots, to reduce the chance of getting a blood clot. I had to take a 10-day, every day at the same time, series of shots in my belly, and my wife was able to give me the shots. And I had, the day of surgery, I weighed 301 pounds, so I was starting my new life and starting my weight loss journey, really starting my weight loss journey. I started at 355 pounds. I was 301 the morning of surgery, and today I weigh 184 pounds. I'm 6'2", and I am inside of my weight height, inside of the weight that I should be for my height. And I did not have any problems when I was discharged. I was supposed to stay on a restricted diet and only do liquids for I don't remember how many days, but there's a certain diet that I had to follow. And then I was eventually released to eating solid foods again. And I can't eat much. I still can't. I think I mentioned in my last video I was supposed to be eating protein that equivalented to 4 to 5 chicken breasts roughly, and because I'm supposed to have almost 100 grams of protein a day, and there is no way I could ingest that much protein. There's no way I can ingest that much protein, and I'm having to, again, I'm drinking Premier Protein and getting, that one is 30 grams of protein in that Premier Protein shake. I just found out this week how much I was supposed to be getting because I had my appointment 2 days ago. I'm recording this right behind part 2. And I found out how much protein I'm supposed to be taking in. I was like, there is no way I can eat that much chicken. There's no way I can eat that much chicken in a day. And I have had, it has been a rapid weight loss, but it has been a very, very pleasing experience. I have gone into having hyperthyroidism. My family physician diagnosed me a couple of weeks ago. He sent me for an uptake scan, and it is showing that I do have hyperthyroidism. He has referred me to an endocrinologist. I am about to leave and go to that appointment to the endocrinologist here in just a few minutes and see what he says. It's not a high thyroidism. It's not a high hyperthyroidism. It's not large, but it's enough that my medical doctor was concerned enough that he wanted to send me to see the endocrinologist. And I don't believe it has had a lot of effect on my weight loss. It may have helped with it because I've lost about 175 pounds in 7 months. And most of that was within the first 5 months. Because my weight loss has kind of slowed down now. I've kind of leveled off, but I'm still losing a little bit. But I'm happy with my weight. I went from probably a 48, 50 waist, and I'm in a 34. I am in the same size I was in when I graduated high school in 1993. I'm very pleased with my waist. I'm pleased with my size altogether because I was in jumbo large sizes before I had gastric sleeve. I was wearing a 3X shirt, and now I can wear this shirt I'm wearing I think is an extra large. I can wear a large from Gap and Old Navy. Like I said, I'm in 34, and I bought some jeans from American Eagle a couple days ago, and they're 34s too, and they fit wonderful. I have a pair of 36-34 I bought on Black Friday from the Gap that are skinny jeans that do not look like skinny jeans. They look like regular jeans now. And it's a wonderful experience. I highly recommend it. I have absolutely no regrets at all whatsoever doing this surgery.
It's 9:02.
Okay. Everyone that I come into contact with that asks me about the surgery, I highly encourage them to go forth and at least check into the process. Not everybody's insurance will pay for it. Not everyone's going to be as fortunate as I was to be able to have the surgery and not have to pay a penny out of pocket. And I say do it. I say go for it. I have no regrets. I thoroughly enjoy my wife and I going shopping and me being able to buy clothes that are so much smaller than I used to be able to wear. As a matter of fact, I had a friend that lost a lot of weight before or during the process of me having surgery, and he gave me 4 garbage bags full of clothes so I wouldn't have to go buy any after I had the surgery. And I would say 95% or greater of what he gave me is too big for me now. I can no longer wear what he has given me. And I'm very pleased. I'm extremely pleased. And I'm going to have to go through my closet. I've already purged a lot of the clothes. I've got to go through my closet and purge some more and get rid of them and take them to the Christian Mission, because I know there's somebody out there that could use some new clothes. They may not be new, but they're new. They would be new to them. I say donate what you've got that you can't wear. There's no need to keep a house full of clothes that you can no longer wear that are too big for you. Yes, there is a chance that I could gain weight back after having this surgery, but it's a matter of controlling myself and not going hog wild and just eating as much as possible to stuff my stomach, because if I stretch my stomach, then I'll of course be stuffing more into my stomach than I should be at this point, or at the point that I would be at. But please feel free, if you have any questions at all whatsoever, please feel free to comment below. I will be more than happy to talk to anybody I can. If I don't see it, it's because I just hadn't had a chance to look at it. But feel free to ask me about it, because I have no problems talking about my journey. Some people are private. Some people don't want to tell their experiences because they don't want people to know they've had the surgery. I don't feel that way. I feel like, being a beacon of hope to those that feel like they have nowhere else to turn. Research it. Go online and research gastric sleeve. I mean, that's what I had. I mean, you have an option to have a lap band or a gastric bypass. But the office that I had my gastric sleeve at, the surgeon said they have been so successful with performing and people having weight loss off of gastric sleeves that they do not any longer offer gastric bypass. And as a matter of fact, they said they are probably going to stop doing gastric bands because people have had so many problems the band slipping in their stomach or whatever. I 100% say go for gastric sleeve if you have the chance to do it. And if it's not for you after you've had it, you always have an opportunity to go forth and have a gastric bypass if you need it. Excuse me. And but like I said, if you have any questions, feel free to ask below. Y'all have conversations about it. Some of you watching this have probably already had gastric sleeve, and some of you that have had gastric sleeve probably feel completely different than I do. You probably would not recommend it, because I have talked to a person that had gastric sleeve and said she's gained a lot of her weight back, and she would not recommend having gastric sleeve. That's her fault because she did not stick to the program. She went forth and gained a lot of weight back because she didn't try to control her eating habits. There's no reason that she should have gained all that weight back after losing all of it, because she should have been restricted and not been able to consume that much. But anyway, that's neither here nor there. If you have any questions, or if y'all want to just have a conversation about gastric sleeve down below, please feel free to comment. If you like this series that I've done, please like my videos. I have more videos coming in the future of different subjects. Please like my videos. Please subscribe. Please hit that bell for notifications when I upload new videos. I would appreciate it. And have a great day, y'all.